Hi, this is Cynthia from Cynthia's Chair, and I'm bringing you along on my journey to have a total knee replacement. Now, that replacement is coming up really soon, and the way I know that is this machine was just delivered. This is called a CPM. It's a continuous passive motion machine, and I will be using this as soon as I have my surgery done and for probably a couple of weeks after. I think I have the machine rented for about 21 days. And so for those 21 days, I'm going to be using this machine and I'm going to show it to you, explain to you why I have to use it. So let's just get started with that. So the machine is set up here on my massage table right now. I probably won't be using it here, but this is the best place for me to do the demonstration. So the machine is self-contained. It does have a power cord and I do have it plugged in. It also has a remote control that I can use to set my range of motion. And I'm going to set my range of motion to where I want my range to be when I am discharged from this machine, which is at 120 degrees. I won't be starting out that the day of my surgery, but that's the goal as far as this machine goes. My goal is to go past that, but 120 degrees is what this machine will take me to. So let me show you how I'm going to use the machine. So I need to get up in here. There is a foot cuff, little piece of Velcro that goes around is just going to secure my foot. There's a strap here that goes across the knee. I don't really need to secure it very tight. It's just to make sure I'm not wiggling and wobbling all over the place. So I've already set this at 120 degrees, and I'm just going to show you how it's going to take me through that range of motion. It is a passive range of motion, which means the machine is doing everything for me. And that is really going to help with my recovery. So I'm just going to kind of lean back here and let you see how this machine is going to bend my knee. It does it at a fairly slow pace. And again, I won't be starting at 120 degrees, but this is where I'm going to be ending. And so it's just going to take me through this, and I will be using this for many hours over the next couple of weeks as I'm recovering until I get my full range of motion back and then moving on my own again, which I hope is rather soon. So we're at 95 right now. There's 100. And 110. And as it reaches 120, it's going to then ease back and put my leg back into full extension. And the doctor will give me the details as to how long I'm supposed to set this up each time. But it's multiple times throughout the day, and it's to keep that joint moving. There's going to be a lot of trauma to that knee, and as a result of that, active range of motion is going to be very painful and very limiting. So this machine is designed to help recover from a total knee replacement. And there, as you can see, it's easing back down. We're about 60 degrees right now. And once it gets me straight, I'm just going to turn it off. We don't need to go through it again. But if you have any questions on this, feel free to comment. And as soon as I can, I'll try to reply back to you. And there's my leg getting back into a straight position, which is also going to be uncomfortable on the day of my surgery. So that's how this machine works. I can set it up anywhere that I'm comfortable. In a semi-reclined position actually feels a little bit better. Although initially I probably can do it sitting up because it's not going to be a big range of motion. So that's this machine. Now to just take my leg out of it, just going to undo the Velcros. When I have my surgery, I won't be able to do this. So I probably will be doing this because my knee will be very sore. Now I want to show you my range of motion. My left knee, I had a total replacement done on that 7 years ago. And fortunately for me, I was able to pretty much get full range of motion back. So I want to show you what that range of motion looks like right now. This is called a goniometer. Physical therapists use this and as well as occupational therapists. This is a small one, and really a physical therapist would be using a bigger one. And what you do is you are measuring your pivot point, which is right there. And you're going to, I don't know if you can see this, but there are darker lines right here. Those are going to be lined up with your bone. And that's what's going to give you an accurate range of motion measurement. And we are going to do some zooming in here so that you can see this. So again, this is my left knee. This was done some time ago. And my range of motion in this knee is 140 degrees. So I'm going to now show you my right knee and what the current range of motion is. Bearing in mind, it's not going to be like this the day of my surgery or for several weeks after. So I have a lot of swelling right now. And the reason I have a lot of swelling is I had to stop taking all of my medications and supplements a couple of days ago because my surgery is coming up very soon and they're going to be doing a spinal block. And I can't have any medication that might thin my blood. So they had me stop everything. That has left me in a lot of pain because I don't have an anti-inflammatory working on this joint right now. So I have a lot of inflammation. However, as you can see, I still have really good range of motion. So same thing, just going to find that pivot point and get this on my long bones. Kind of hard to see. I think I might have it lined up there. And again, I'm at 140 degrees. And that is my goal ultimately. Now, most patients who have a total knee replacement, the doctor and maybe the patient themselves limit to about 120 degrees, which is what this machine took me to earlier. I discussed that with my doctor before I had my first knee done and said, you know what? I need full range of motion back. I need to be able to bend my knees. I work with children. I'm down on the floor with infants throughout the day, and I need to literally be able to get on my hands and knees. And he reassured me that I would be able to get the range of motion back. And as you saw, whenever I measured my left leg, I did get that range of motion back, and I'm very happy and pleased with it. I don't have any pain whenever I do this. There's a little bit of stretching sometimes of my tendons, but you know, that probably comes with age as well. So my goal is to have the same range of motion back whenever I'm done with my recovery with my right knee. Now, the other thing I wanted to point out, and I'm going to be making a short video about my packing list for the hospital stay. And one of the things I wanted to point out to you today is today's probably one of the last days that I can wear capri pants like these or workout pants because of how tight they are right here. After my surgery, my knee is going to be significantly swelled and I won't be permitted to have something this tight on, nor will I even be able to get it up and over my leg. So I will have to have packed in my suitcase some capris or shorts that have a wider bottom to them so that I can easily get it up over the swollen leg. So that's it for now. If you have any questions, please feel free to put those down in the comments below and subscribe to my channel if you get a chance and hit that notification button and you'll get to see updates as I'm going through this whole process. Thanks for coming along the journey with me.